It's tempting, is brightly colored, looks good, is within reach, and it's poison. Each year, hundreds of thousands of people are poisoned. Several thousand die.
Teresa?
Most poisonings are accidental and avoidable. Anyone can be poisoned when warnings on labels are not read, medicines are taken in the dark, products that give off fumes are used in a poorly ventilated area, or instructions on medications are not followed. Young people are often poisoned by sniffing glue, paint, or cleaning fluids, experimenting with drugs, or downing a full bottle of hard liquor. But those most often poisoned are children under the age of 5, who do not have the knowledge or experience to protect themselves from harmful substances. Boys are poisoned twice as often as girls. The most dangerous age is 1 to 3, when children are constantly exploring the world around them. A child is curious, fearless, and can't read warning labels. What a child sees, she reaches for, puts in her mouth, and swallows, especially just before mealtime. Smell and taste, no matter how bad, will not stop her.
Teresa, where are you?
Growing children come into contact with many things commonly found in the home, which may be poisonous. Some people have died from poisoning, even though they did not appear to be sick right away. Others have died because the poison acted very quickly or because they tried to treat themselves with home remedies or so-called antidotes. But if you act quickly and correctly, the help you give will lessen the effects of the poison. You could save a life. Learn to recognize signs of poisoning. For example, someone suddenly becomes nauseated, starts to perspire, becomes pale or flushed, feels weak, has a severe headache or troubled breathing. Suspect poisoning caused by drug overdose if someone is sluggish or overactive. If eyes move rapidly from side to side, if the pupils are dilated or constricted, or if there is a radical change in behavior. Suspect poisoning if a child is unusually drowsy or overactive, is drooling and won't swallow, vomits, or complains of abdominal pain, has stains or irritations around the mouth, has irregular or abnormal breathing. If you know or even suspect that someone has been poisoned, don't wait to see what effect the poison may have. Call a poison control center, emergency department, or doctor immediately. Keep these numbers near your phone at all times. Don't trust your memory. Write down any instructions you are given. Do only what you've been told to do. If you are instructed to give syrup of ipecac to induce vomiting, give 1 to 2 glassfuls of water with it. Vomiting should follow within 15 to 20 minutes and must be forceful to be effective. If you're instructed to bring the poison victim to the hospital, be sure to bring all the vomitus so that it can be examined. First aid instructions, printed on container labels, may be wrong. The most important action to take when poisons are swallowed is to dilute the substance by immediately giving a conscious victim 1 to 2 glasses of water or milk to drink. Do not treat poisoning in any other way. Get to a phone as quickly as possible to call a poison control center, emergency department, or doctor for further instructions. Take suspected containers and their contents with you. Never try to give liquids to a very drowsy or unconscious person whom you suspect has suffered poisoning. If you suspect drug overdose, don't try to treat it yourself with strong coffee or by making the victim walk it off. It won't work. Get to the emergency department quickly. The victim's life depends on expert care. Poisoning also can occur from venomous bites. All snake bites, poisonous or non-poisonous, should have medical attention. Do not give alcohol or sedatives or any medication containing aspirin to the victim. If severe symptoms occur within 15 minutes of the bite, the venom must be suctioned out. Apply a constricting band 2 to 4 inches above the bite. The band should slow circulation, but not stop it. You should feel a pulse beyond the band and be able to slip one finger under it. Make cuts 1/2 inch long through each fang mark and just through the skin. Suction the cuts with a suction cup if available, or use your mouth for 30 minutes. If you use your mouth, be careful not to swallow any of the venom. Rinse your mouth when finished. Seek medical assistance immediately. Poisoning also can result from contact with certain chemical compounds.
Hey, quick!
Flush the area with water for at least 20 minutes while removing all affected clothing, including underclothes and jewelry. Have the victim see a doctor as soon as possible. Inhaled fumes may result in poisoning. Get the victim into fresh air, but don't become a victim yourself. Don't inhale the fumes. If he is conscious, have him breathe deeply and slowly.
Dad. Leanne. Call an ambulance.
If the victim is unconscious, check breathing and heartbeat. If you have been trained, use cardiopulmonary resuscitation as in this simulation, if necessary, until they are restored. Then, quickly, get the victim to the emergency department. But even more important, you can do many things to prevent accidental poisoning. When you buy household products or medicines, read the warning labels. They are for your protection. Keep all substances in their original containers. If you must transfer a product to a new container, be sure to label it clearly. Never use cups or pop bottles to store household products. To a child, they mean food. Store cleansers, furniture polish, and other products that may be poisonous out of reach and out of sight of children. And keep hazardous products away from foods or medicines. There are many look-alike containers and substances. For example, aspirin and some rat poison pellets look very similar. Rinse out containers that held household products before discarding them. Place them at the bottom of your trash bin where a child will not find them. Iron preparations and vitamin tablets can cause serious poisoning, even death, when taken in overdose amounts. Keep them off the breakfast table or anywhere children can reach them. Also place aspirin and aspirin substitutes out of children's reach. Keep all medications under lock and key.
Call medicines and vitamins by their proper names. Don't tell children that medicine is candy to get them to take it, because they will, the whole bottle, when you aren't looking.
Avoid taking medicine in front of children. Don't tell them how good medicine makes you feel. They will want to try it. Never take or give medicine in the dark. And of course, take only the amount instructed by the label.
Dispose of all old medicines. And then rinse the container well.
Place all medications and cosmetics brought into your house by guests out of the reach of children. And keep all houseplants out of the reach of children. Many plants can poison, even when leaves are just nibbled or the water in which plants have been soaked is swallowed. Don't let a child pick at and eat caulking around window panes, and remove chipped or cracked paint that may tempt a child. Keep children away when you use any spray insecticides or spray paint. Protect yourself from inhaled fumes by having good ventilation and wearing a mask when necessary. Keep a bottle of syrup of ipecac in your home. When recommended by a poison control center, hospital, or doctor, it can be used to induce vomiting.
And always keep the telephone numbers of your doctor, the nearest emergency department, and poison control center close to your phone, and instruct everyone in your family to use them in case of poisoning. By knowing what to do when someone is poisoned and acting quickly, you could save a life.